Imagine this. You wake up, not in a modern hospital, not even in a village, but somewhere deep in the wilderness. 30,000 years ago, you look down and notice something strange, a hard lump beneath your skin. At first, it doesn't hurt, so you ignore it. Days pass, then weeks. The lump grows larger. Soon, it starts to ache. You can't hunt. You can't carry food. You can't even sleep without pain. You ask your tribe for help. But there's one problem. No one knows what cancer is. There are no doctors, no hospitals, no scans, no chemotherapy, no painkillers, not even the word cancer. So, what happened next? Did ancient humans simply accept death? Or did they find their own ways to fight a disease they couldn't even understand? Here's something most people never realize. Cancer did not begin in the modern world. It didn't appear after factories. It didn't arrive with fast food. And it certainly wasn't invented by pollution. Long before cities, long before farming, even before the pyramids were built, cancer already existed. Scientists have found evidence of tumors in ancient human remains, in Egyptian mummies, and even in fossils millions of years old. Which means one astonishing thing. Cancer has been following life on Earth for an incredibly long time. But here's where the story becomes truly fascinating. If ancient humans had no medicine, no microscopes, and no idea what was happening inside the body, how did they explain these mysterious growths? And more importantly, what did they do about them? That's exactly what we're about to uncover. We're traveling back to the Stone Age, then ancient Egypt, Greece, Rome, China, and beyond, to discover how our ancestors faced one of humanity's oldest enemies, using nothing but nature, experience, and hope. Because sometimes, the most unbelievable medical stories didn't happen inside hospitals. They happened around a campfire. Before we meet the first ancient healers, we need to answer one question. Was cancer actually common back then? Most people assume the answer is no. After all, there were no cigarettes, no processed food, no polluted cities. So, no cancer, right? Not exactly. Cancer isn't caused by just one thing. It can begin when cells make mistakes while dividing. Those mistakes can happen naturally, even in a perfectly healthy environment. In other words, cancer didn't need modern life to exist. Modern life can increase the risk of some cancers, but it didn't create the disease itself. So why don't archaeologists find cancer everywhere in ancient skeletons? The answer is surprisingly simple. Most ancient humans never lived long enough. Think about life 20,000 years ago. Every single day was a fight to survive. Finding food, escaping predators, surviving harsh winters, avoiding deadly infections. A broken bone, a deep cut, or a simple tooth infection could end your life. Many people died in their 20s, 30s, or 40s. But here's the twist. Most cancers become much more common as people grow older. Today, many people develop cancer in their 60s, 70s, or later. Ancient humans often never reached that age. Not because cancer didn't exist, but because something else usually killed them first. That doesn't mean no one developed tumors. Some did. Archaeologists have discovered ancient skeletons with abnormal bone growths. That may have been cancerous. Egyptian mummies have also revealed signs of certain cancers through modern scans. These discoveries tell us something remarkable. Our ancestors were fighting diseases they couldn't see, couldn't name, and couldn't understand. But when someone in the tribe developed a strange lump, or a wound that never healed, who did they turn to? Not a doctor, not a surgeon. They turned to the healer. Imagine living thousands of years before the first hospital. Someone in your family develops a hard lump. It keeps growing. The pain gets worse. They lose weight. Their strength slowly disappears. Who do you call? There is no doctor, no pharmacy, no medicine. Instead, the entire tribe turns to one person, the healer. Every ancient community had someone like this. An elder, a shaman, a herbal expert, someone who had spent years learning from nature, not through books, but through experience. Generation after generation, they knew which plants soothed pain, which leaves stopped bleeding, Which tree bark reduced fever? To the tribe, this wasn't magic. It was survival. But here's the problem. No matter how skilled the healer was, they had no idea what cancer actually was. To them, a growing lump wasn't a disease caused by damaged cells. It was simply a mystery. So, what could these healers actually do? If the lump was on the skin, they might clean it with water, cover it with honey, animal fat, or crushed medicinal plants. Some herbs may have reduced inflammation. Others could help relieve pain. Honey, for example, naturally slows the growth of many bacteria and helps protect wounds from infection. That made it one of the most valuable natural treatments in the ancient world. But here's the twist. None of these treatments could cure cancer itself. They weren't attacking the disease. They were helping the person survive its effects, or easing their suffering. Sometimes, a lump would stop growing. Sometimes it wasn't cancer at all. It might have been a harmless cyst, or another condition that healed on its own. To the tribe, it looked like the healer had worked a miracle. But other times, the lump kept growing. The pain became unbearable, and the healer could only watch as an invisible enemy slowly won. Yet this wasn't the end of humanity's fight. As civilizations began to rise, people started writing down medical knowledge for the very first time. And one civilization was far ahead of the rest: ancient Egypt. When most people think of ancient Egypt, they imagine pyramids, golden masks, and giant temples. But Egypt gave the world something even more valuable: one of the earliest written medical records in human history. Instead of passing knowledge only through stories, Egyptian healers began writing it down. Disease, injuries, broken bones, surgical procedures, herbal remedies. For the first time, medicine was becoming organized. One ancient medical document, known today as the Edwin Smith Papyrus, described wounds, fractures, and even tumors with remarkable detail. Another, the Ebers Papyrus, recorded hundreds of treatments using herbs, oils, honey, and minerals. The Egyptians weren't guessing anymore. They were observing, recording, and learning from every patient they treated. But then, researchers found something truly surprising. Hidden inside these ancient texts was a description that still fascinates doctors today. It spoke of unusual lumps found in the breast. The ancient physician carefully examined them. Then came a heartbreaking conclusion: there is no treatment. Imagine reading those words. Nearly 3,500 years ago, the Egyptians recognized that some hard tumors behaved differently from ordinary wounds. Some kept growing, some returned, some couldn't be removed. They didn't call it cancer. That word didn't exist yet, but many historians believe they were, describing what we now recognize as certain forms of breast cancer. So, what did Egyptian healers do? They focused on what they could control. They cleaned wounds with honey, applied herbal mixtures, used linen bandages, and in some cases, performed surprisingly advanced surgical procedures using bronze instruments. Their goal wasn't to destroy cancer. They didn't know how. Their goal was to reduce suffering, prevent infection, and give the patient the best chance to survive. For its time, that was extraordinary. But Egypt wasn't the last civilization to search for answers. Hundreds of years later, a group of thinkers in ancient Greece would give this mysterious disease a name, one that is still used. More than 2,000 years later, ancient Greece changed the way humans thought about disease. Instead of blaming every illness on angry gods or evil spirits, some Greek physicians began asking a different question: what if disease has natural causes? It was a revolutionary idea, and at the center of it stood one man, Hippocrates, often called the father of medicine. While examining patients with hard, spreading tumors, Hippocrates noticed something unusual. Some growths had swollen veins stretching outward from the center. To him, they looked like the legs of a crab, so he gave them a name: karkinos, the ancient Greek word for crab. Centuries later, the Latin form of that word became cancer, the name we still use today. But naming the disease didn't mean understanding it. The Greeks were centuries ahead of many civilizations, but even they couldn't see what was happening inside the human body. No microscopes, no x-rays, no laboratory tests. So they created theories. The most famous was the four humors. According to this idea, the human body was controlled by four fluids: blood, phlegm, yellow bile, and black bile. If these fluids stayed balanced, you stayed healthy. If they didn't, disease appeared. Hippocrates believed cancer was caused by too much black bile collecting in one part of the body. Today, we know that's completely wrong. Cancer isn't caused by black bile. It's caused by genetic changes inside cells. But here's the remarkable part. Even with the wrong explanation, Greek doctors made an observation that was surprisingly accurate. They realized that not every tumor should be cut out. Some tumors returned, some spread, and some patients became even worse after surgery. Without anesthesia, without antibiotics, and without understanding infection, operating on deep tumors was incredibly dangerous. Sometimes, doing nothing gave the patient a better chance of surviving than a risky operation. It wasn't because they understood cancer. It was because centuries of experience had taught them a painful lesson. The disease they called carcinos was unlike anything else they had ever seen. But the story doesn't end in Greece. The Romans inherited Greek medicine, then added something entirely their own, some useful ideas, and some of the strangest medical beliefs in history. When Rome became one of the greatest empires in history, it didn't just conquer land. It inherited knowledge, Greek books, Greek physicians, Greek medical theories. Roman doctors continued treating wounds, setting broken bones, and performing surprisingly advanced surgeries. Military surgeons became especially skilled. Every major battle produced hundreds of injured soldiers. So Roman medicine improved through experience. They developed surgical tools, scalpels, forceps, hooks, bone saws. Some of these instruments look surprisingly familiar even today. But when it came to cancer, they were still fighting in the dark. Imagine a Roman doctor examining a patient with a large lump. If the tumor was small and close to the surface, he might decide to remove it, not in a sterile operating room, but in a simple treatment space, without anesthesia, without antibiotics, without any understanding of bacteria. The patient would often be held down by assistants, while the surgeon worked as quickly as possible. If the tumor could be removed completely, the patient might survive. But if even a small part remained, the growth could return. And if infection entered the wound, it could become even deadlier than the tumor itself. Many Roman physicians eventually reached a difficult conclusion. Some cancers were simply beyond their ability to cure. So instead of aggressive surgery, they often focused on easing pain, cleaning wounds, and making the patient's remaining life as comfortable as possible. It wasn't defeat. It was the limit of medical knowledge at the time. But while some Roman doctors relied on careful observation, others believed cancer and disease were influenced by strange natural forces and superstitions. Those ideas would shape medicine for centuries to come. And in the Middle Ages, humanity's fight against cancer would take another unexpected turn. The fall of the Roman Empire changed Europe forever. Cities declined, trade slowed, knowledge was lost. Many of the medical texts that survived were copied by hand in monasteries. For centuries, medicine advanced much more slowly than before. If someone developed a mysterious lump, most people still had no idea what it really was. Cancer remained an invisible enemy. Doctors couldn't see it. They couldn't test for it. And they certainly couldn't stop it. So once again, people searched for answers in the only places they knew: nature, faith, and tradition. Medieval healers filled their shelves with dried plants: chamomile, sage, garlic, willow bark, frankincense, honey. Some were made into teas. Others became poultices placed directly over painful swellings. A few of these remedies actually had real medical value. Honey helped reduce infection in wounds. Willow bark contains compounds related to the substance that eventually led to aspirin. Some herbs may have eased pain or reduced inflammation. But here's the important difference. Relieving symptoms is not the same as curing cancer. No herb could stop cancer cells from growing. No potion could remove a tumor deep inside the body. Many patients felt temporary relief, only for the disease to continue spreading. And because no one understood what cancer truly was, people often blamed something else: bad air, an imbalance in the body, or even divine punishment. It wasn't cruelty. It was the best explanation they had. Yet while much of Europe struggled to understand disease, elsewhere in the world, physicians were developing remarkably detailed medical systems. In China and across parts of Asia, doctors were studying the human body in a very different way. Some of their observations would survive for thousands of years. While Europe struggled through the Middle Ages, China was developing one of the world's oldest continuous medical traditions. Ancient Chinese physicians didn't see the body as a collection of separate organs. They saw it as a connected system. Everything was linked: the heart, the lungs, the liver, the mind, even emotions. If one part fell out of balance, the entire body could suffer. Instead of asking, "Where is the disease?" they asked, "What has disturbed the body's balance?" It was a completely different way of thinking, and for thousands of years, it shaped how Chinese doctors treated illness, including mysterious lumps and swellings. Ancient Chinese medical texts described hard masses, persistent swellings, and growths that slowly became more painful over time. Doctors developed herbal formulas, massage techniques, acupuncture, and dietary recommendations to ease symptoms and improve overall health. Some herbs may have helped reduce inflammation. Others were used to relieve pain, improve digestion, or support recovery from illness. But here's the important truth. Despite centuries of careful observation, no ancient civilization, including China, had a cure for cancer. What they could do was help patients feel stronger, reduce suffering, and in some cases, slow complications caused by infections or poor nutrition. Their treatments reflected thousands of years of experience, even if they couldn't eliminate the disease itself. And that's what makes this story so remarkable. Across Egypt, Greece, Rome, Europe, and China, people spoke different languages, worshipped different gods, and built different civilizations. Yet when cancer appeared, they all reached for the same things: nature, knowledge, experience, and hope. But if ancient medicine couldn't truly defeat cancer, how did humanity finally begin to understand what it really was? The answer wouldn't come from another empire. It would come from science. For thousands of years, doctors could only guess. They could see the outside of a tumor, but never what was happening inside it. Then, everything changed. The invention of the microscope opened an entirely new world. For the first time, scientists could look beyond skin, beyond organs, and into the tiny building blocks of life: cells. Every human body is made of trillions of them. Most divide in an orderly way. Old cells die, new cells replace them. It's a process that keeps us alive. But sometimes, something goes wrong. A cell is damaged. Instead of stopping, it keeps dividing, again and again and again, until a small group of abnormal cells becomes a tumor. Humanity had finally discovered that cancer wasn't a curse. It wasn't black bile. It wasn't angry gods. It was a disease of the body's own cells. Suddenly, thousands of years of history made sense. The Egyptian physician who wrote, "There is no treatment." The Greek doctors who named the disease. The Roman surgeons who couldn't stop it. The medieval healers who relied on herbs. The Chinese physicians who focused on balance. None of them were foolish. They were working with the best knowledge available in their time. They couldn't see cells, so they couldn't understand cancer. Today, doctors use MRI scanners, CT scans, biopsies, genetic testing, chemotherapy, radiation therapy, immunotherapy, and highly specialized surgery. Treatments that ancient healers could never have imagined. Yet, their observations, their records, and their determination to help the sick became the foundation on which modern medicine was built. But this story isn't really about cancer. It's about something even bigger: the endless human desire to understand the unknown. And that journey is still continuing today. What changed wasn't the disease. It was us, our knowledge, our science, and our refusal to stop searching for answers.